These three thought leaders are experts in using phase contrast microscope, an invaluable aid for the diagnosis and treatment of periodontal disease. So with that, please welcome my friends, Dr. Tom McCawley from Fort Lauderdale, Dr. Stephen Brown from Philadelphia, and Dr. Joe Nemeth from Southfield, Michigan. Welcome, guys. How you doing? You're in the
Great.
Let me start with you, Dr. Brown. This is kind of the setup question as to why we're here. Talk about your experience with using the microscope and why is it so important to have it in your practice?
Well, for starters, periodontal disease is a kind of an infection caused by bacteria and parasites and other organisms that have been known to infect the mouth. Patients in general have a difficulty in getting their heads around the fact that this is, in fact, an infection. They've been told they have gum disease, but they don't really know what that means. So typically what I do in my practice, and I'm sure the other members of the panel do as well, I let my patients know that we're dealing with an infection, that I'm going to take a small sample of material from around their gum line, doesn't hurt, and we're going to look at it under a phase contrast microscope. And when we do, we see the bacteria swimming around and in, technicolor and stereophonic sound, so to speak, and patients are not only encouraged to go forward with it, but they see that there's something actually going on, and literally they don't want to have that anymore. And so consequently, it gives them a real realization that there is an active infection and that now they know that there's something that we can do about it. It also serves as kind of a scorecard, because the activity that they see at the beginning of treatment, hopefully as treatment goes along, they're going to see a diminution of those bacteria significantly.
Very good.
It really just lets the patient know that they have an infection and that we're going to be treating the actual cause of the disease, different from many practitioners which treat the result of the disease, pockets. And most of us got into this because we discovered that just getting rid of the pockets often didn't get rid of the infection. Now we have a method that tells us that the patient has an infection, and a method we can test at the end to see that it's gone.
We have an 86-inch TV that takes up almost the entire wall of our patient operatory, the room that we work in. So the patient sees these organisms they're just right there in front of their face. And it freaks the patient out. It really basically freaks them out. These things are in my mouth. Oh my God. And not only does it freak them out many times, which sounds horrible, but they sometimes need to be jerked out. They need to be jerked out of their complacency because they're not pain. They don't know anything until they see these things crawling around that were in their mouth. And they then take ownership of it because it's their mouth. They see it. They take ownership of it. If they don't take ownership of it, they're not going to work hard to help eliminate it.